Hello and welcome to The Virus. I'm Jeremy Fernandez. There have been some significant changes to COVID restrictions in parts of the country. So what impact could that have on the spread of the virus? Plus, how do you treat COVID? We'll answer that and more of your questions later on in the show. But first, those rule changes for close contacts. They come into effect in Victoria and New South Wales this weekend, in the ACT on Tuesday and in Queensland from 6 p.m. on Thursday. So, if you are a close contact living in these jurisdictions, you'll no longer have to isolate for 7 days if you have no symptoms, but you will have to take rapid antigen tests over the course of that week, daily if you're in New South Wales, less if you're in Victoria and the ACT and also Queensland. So if you're a close contact, you'll need to wear a mask indoors and avoid certain places like hospitals and aged care homes, unless you get a special exemption. You'll also need to tell your workplace that you've been a close contact and work or study from home if you can. If you test positive to COVID, you still must isolate for 7 days. Let's bring in Casey Briggs now. Casey, there have been a couple of high-profile COVID cases this week. The Labor leader Anthony Albanese, WA's Premier Mark McGowan, both testing positive. How are the case numbers looking in Australia right now?
Yeah, g'day, Jez, and with the greatest respects to those two political leaders, and we certainly hope they get well soon. They are, of course, nothing special in the COVID numbers. There have been hundreds of thousands of cases this week. Let's just take a look at the national case figures. We're recording about 43,000 infections a day at the moment, but it does look like we are now past the sort of hump of that, what I'll call the second COVID wave of 2022, and I'll deliberately say the second one because there may well be more of them in the months to come. And our hope is that as this virus continues to spread through the community, those waves will get smaller and smaller and smaller on average as time goes on. We're now seeing that the wave looks to be receding in virtually all parts of the country, but I do want to take you to Western Australia quickly as well, because the improvement we've been seeing there looks to have maybe at least paused, and we're seeing maybe a small lift in cases again at the moment. 6,900 a day is about what we're seeing. And Jeremy, earlier in the year, I think we had some discussions about, what does living with this virus look like, and what's a sort of acceptable or a normal or a kind of amount of deaths a day that we should kind of get used to. And it looks like that number is between about 20 and 30 deaths a day on average. Back in the middle of March, we got that number down as low as about 20 deaths a day. It's been slowly creeping up again. We're now sitting at about 28 or 29 deaths a day as a sort of average number. That is a significant number of people dying with this virus every day. I think it's more than a lot of people expected when all this modelling was being prepared and released before we knew of the Omicron variant, before it had been discovered in the world, and that is, really settling down as the number that seems to be persistent.
And at the very same time, these rules are changing. We'll get to that in a moment, but let's talk about vaccine doses. How quickly are those being delivered?
I think that's one of the surprising things that we've seeing now after such real eagerness to get vaccinated in 2021, after such a quick pace of getting first and second doses in. Have a look at the figures, the daily doses that we're seeing going into arms each day at the moment. And you can see since we've been getting that daily data in April of last year, we're now seeing smaller numbers than we've ever seen before. We're right back at the pace that we were seeing right in that first month of the vaccine rollout, when, of course, we were very constrained by supply. We're not constrained by supply now. They're just people aren't coming forward to get the vaccine doses, and it's left us in a position where, frankly, the third dose uptake is quite a bit lower than I thought it would be. When we first started to see third doses rolled out, about 52% of Australians have had their third dose. So it's almost a bit of a surprise that, we were so keen to get our first and second doses when, the moment that those lockdowns have ended, the moment that we've started sort of moving back to, treating this virus, in a way that we treat other respiratory communicable diseases, all of a sudden that vaccination rate has really slowed down.
There's a sense of we're getting back to normal pre-COVID levels. Casey, thank you very much. Let's get more now on the potential impact of those changes to COVID restrictions with our panel. Professor Jenny May is a practising GP and Director of the University of Newcastle's Department of Rural Health based in Tamworth. And Professor Nancy Baxter is a clinical epidemiologist and the head of the School of Population and Global Health at Melbourne University. Welcome to both of you. Professor Baxter, so much of our lives over the past couple of years has been governed by this idea of following the best health advice. How would you rate these new rules?
So, I don't think it's unreasonable to think about relaxing household contacts being isolated if things were under control in terms of the numbers of COVID patients. But, what you're saying and what we just heard is that although we seem to be over the hump of the second Omicron wave, we still have a very, very high number of COVID cases in our community and a high number of COVID deaths. And we know that with the high risk of household transmission, if those people are not isolating, we are going to increase the risk of further transmission outside the household. So I think what we're going to end up with is a high plateau of cases, not just because of loosening this restriction, but the many restrictions and protections that have been loosened. And so we're just going to end up having more cases than we would have had if we had had sensible measures in place longer.
And so, Professor Baxter, if you are a close contact, a household contact, how certain is it that you will catch COVID?
Well, it's a great question. And early in the pandemic, we had kind of rates that were 10 to 20%. But Omicron is a game changer in that respect. We have some data from Norway that says about a quarter of household contacts will become positive. Some data from the United States that says about a half of household contacts would become positive. And I'm sure many people watching have had experience with either their own family, COVID going through their entire family and almost everyone catching COVID, or, from knowing neighbors or friends where, COVID has spread across their entire family. So Omicron's very contagious. It's hard to contain it in the home. You can, and it's worth trying, but it's very difficult. So these household contacts that we're allowing to mix and mingle have, at least a quarter, probably 50% chance of actually becoming COVID cases themselves.
Dr. May, who is most vulnerable under these changes?
Well, the concern is that our relatives and friends who are vulnerable, those over the age of 65, those undergoing chemotherapy, and those with other immunosuppressive illnesses are honestly in fear of some of these changes. So they're finding that they need to isolate almost completely and are at risk from their children bringing home COVID from school or their relatives inadvertently bringing it home from the high prevalence that we're currently seeing in the community.
And do you expect that the Easter long weekend, the school holidays, the upcoming Anzac Day long weekend will be or will have been super spreader events?
I do, and I would add into that, I'm coming to you from Tamworth, northern New South Wales, where we're celebrating the Country Music Festival. And I would suggest to you that Easter and country music and Anzac Day are very likely to cause a very large uptick in figures, certainly in our area and for the visitors that are with us now. So I haven't seen this this plateauing in cases that is being seen on a national level. I don't know whether regional communities are a bit slower in some of these trends, but certainly we're seeing high numbers of COVID patients anecdotally. I don't think we're picking them up with our RAT testing and PCR testing, and I think therefore we're underestimating the prevalence of COVID in the community.
Professor Baxter, one of the issues we run into, as Dr. May says, is that we don't really know how much COVID is circulating in the community. So it must be tough to gauge exactly how this idea of taking personal responsibility, self-testing, self-isolating, how well that model is working when we don't really know the numbers.
Well, I think that the numbers that we have would indicate it's not working particularly well. We have a high rate of hospitalizations. We have, as Casey said, a death rate that we would have been very surprised to have heard about, expecting, a year ago when we were talking about the modeling from the pandemic. When you're looking at the number of deaths, we're tracking to reach about 10,000 deaths this year from COVID, and that's making it kind of the third most common killer of Australians. So this is still a major disease that's affecting lives. It's also affecting disability. With all these cases, we expect a significant number. It's not a high number, but it's a real number to get long COVID, meaning they're going to have lingering effects of COVID for many months. And so this is going to increase the either temporary or permanent disability in our communities. So I don't think we're we're handling the personal responsibility part of the pandemic well. And I wish we still had some protections in place that would help us, control the number of cases and control transmission. Basically, we've entered the phase of the pandemic where our elected officials have decided that controlling transmission is no longer on the agenda.
Dr. May, some of this responsibility now shifts to employers. We already have a workers shortage in a number of sectors. What is the impact on workplaces likely to be, and what can employers do to mitigate some of that risk?
So, Jeremy, the effect is already here and now. And interestingly, again, country music, we've got a high demand, obviously, for hospitality workers and other workers. And we have significant portions of our working population off with COVID symptoms at the present time. So it's already impacting quite significantly. And as you've noted, or we've noted, I think that impact will grow. So what should employers do? I think employers are in a really difficult position. And certainly I, with the university, have a really difficult duty of care in trying to support, for instance, health students and ensure that they don't bring COVID to their health placements, for instance. So we're recommending quite rigorous restrictions continue. So we're basically insisting on mask wearing indoors. We're trying to maintain social distancing, and we're trying to use a fair amount of PPE. And that's all preventive. That's all trying to reduce transmission to the most vulnerable. But employers out there in the more general workforce, in the general work stream, have got a really difficult situation to work with. And now that they know that close contacts of people who are COVID positive are going to be mingling in their workplace, then they should be expecting an increased rate of absenteeism in their employees as COVID moves through those workplaces.
Dr. May, Jenny May, Nancy Baxter, great to have you both on the program. Thank you so much. Let's go over to your questions now. The ABC's medical reporter Sophie Scott is here with some answers.
What treatments are available for people when you catch COVID?
The treatments depend on whether your disease is mild, moderate or severe. For a mild illness, you might have symptoms such as a fever, cough, nausea or vomiting, and that's probably managed by your GP with over-the-counter treatments like painkillers or drinks designed to keep you hydrated. For a moderate illness, you might have all those symptoms as well as breathlessness. With severe illness, you might have difficulty breathing and even need oxygen. If you're an adult with mild COVID who is not in hospital, and that's probably the majority of people, experts recommend 7 different prescription drugs that can help, including antiviral drugs such as remdesivir. But the evidence and recommendations are always being updated, and the treatment can change if you're at greater risk of complications. So you could look at a website which is covidevidence.net.au, but please do speak to your doctor.
What happens if you still test positive or present symptoms after day 7 of infection?
Sometimes you can return a positive COVID test if you've recovered. And this is because people with COVID have infected cells that you can release into the environment through breathing, coughing or sneezing. It's called viral shedding. After you've recovered, these non-infectious fragments can be left in your body for some time. So even if you test positive after 7 or 10 days, experts say you are unlikely to transmit the virus to other people.
Why is it that some people don't catch COVID despite being a close contact?
That's a really good question. Scientists are trying to work out why a whole household could become infected apart from one person. Dr. Vanessa Bryant from the Walter Annalisa Hall Institute is looking into the issue. She says you need to consider environmental factors like how long you were exposed to an infected person and whether you were fully vaccinated, including boosters. Also, you might have had COVID in the past and not realised it, meaning you have some natural immunity. There might also be features of your immune system or genes, meaning you are naturally more resistant to COVID. And the answers to these questions could help develop effective new treatments for COVID.
And if there's something you want to know, go to the coronavirus section of the ABC News website and click on Ask Us Your Questions, and there you can submit your question to the team. And that is the show for this week. Thanks for your company. Bye for now.